me videos. So today we're going to be looking at the anterior abdominal wall muscles. Get myself sorted. Okay, so we're going to start off looking at the rectus abdominis, and I'm sure you'll all be familiar with this one. So this is the top layer of our abdominal muscles, and it's what's commonly known as your six-pack, which you may or may not be able to see. So as you can see from the picture, it consists of two flat parallel muscles, and the gap in the middle is usually got what's called the linea alba down the middle, and that's a line of connective tissue. So its origin is down at the pubic level on the pubis, as you can see, and the pubic symphysis, which is that bit in the middle that joins the two. And then it travels up, fibers ascending vertically to the base of the ribs, and as you can see, it connects onto the cartilage of the ribs and onto the very bottom part of your sternum, your breastbone. So it's crossing your lumbar and thoracic, the intervertebral lumbar and thoracic area, and as you can see, its function, if it contracts, is going to be to flex the vertebral spine, the vertebral column, and it will also, as it contracts, tilt the pelvis backwards. It also helps to just tense the abdominal walls, and it assists in compressing the contents of your abdomen. So that's the most superficial of our abdominals, our rectus abdominis. Okay, so moving on to our external obliques. So we've got two layers of our obliques, our external and internal. So we're starting off with our external, which, as you can tell by the name, are the more external, the more superficial ones. And they're lateral muscles, and they extend from the lower part of the ribs round and down to the pelvis, covering, as you can see, covering the sides of the abdominal area. So let's have a little look. So their origin is the outer surface of the bottom 8 ribs. They kind of look a little bit like finger-like projections from there. And then inserts mainly into the linea alba, that white line of connective tissue down the center of your abdomen, but also right down, as you can see, into the tops of your iliac crests there. So they work to stabilize the core, and they also work when they're contracting concentrically. If one side's working unilaterally, it helps with rotation and with lateral flexion, working with the internal obliques. And when both sides are working, they work with your rectus abdominis to allow for flexion of the vertebral column. So those are your external obliques running right up from the ribs down to your iliac crest and the linea alba. So we've looked at the internal obliques and those fibers that run downwards. Now, if we have a look at those are the external obliques, the internal obliques. So this is a broad, thin muscle, and it's one of the deeper muscles. So it sits between the external obliques and your transverse abdominis. And you can see it's got kind of an oblique orientation of the fibers running up. So they run almost sort of 90 degrees opposite to the external fiber orientation. So they start at the thoracolumbar fascia, that large area of connective tissue that covers the lower portion of our back of our thorax and the iliac crest, and then connects into that large sort of connective area, aponeurosis at the front and the linea alba and the bottom 3 ribs. It crosses the joints of the lumbar lower thoracic vertebrae, and if it works unilaterally with the external obliques, it works to rotate and laterally flex the trunk. And bilaterally, again, it works with the external obliques and rectus abdominis to flex the vertebral column. So we think of the internal obliques as part of that deep core musculature. It's not the deepest of the abdominals, but it's part of that deep stabilizing core of muscles that we have. So the last one we need to look at in this short series of abdominal muscles is our transverse abdominis. So this acts a little bit like a belted back support or a corset, and it's our deepest of all of our abdominal muscles, and it kind of wraps around the trunk from the front to the back. So you can see in the image that the orientation of the fibers is really horizontal, and it provides postural support, and you can see if those contract, they're going to hold and support your abdominal contents in and support those organs that are located within the trunk. So its origin is again the thoracolumbar fascia, the lower part of the six ribs, the cartilage of the six ribs, lower six ribs, and your iliac crest, inserts into the linea alba, crosses the lumbar vertebrae joints, and it compresses the abdominal cavity. And this works to increase your intra-abdominal pressure, which helps to support the abdominal contents. So that's your transverse abdominis, the deepest of the abdominal muscles. On top of that, you've got the internal obliques. On top of that, you've got the external obliques. And then the most superficial and anterior muscle is your rectus abdominis. Okay, that's your abdominals done.